you might think that psychiatrists are they're out to push pills or put labels on people, or, they think they have all the answers. In fact, they don't, nor is that the point. Dr. Jessica Beachkofsky has been practicing psychiatry and empowering patients for over a decade. And she loves helping people understand more about themselves and mental health while offering treatments that align with their values. You're about to discover what an actual doctor-patient alliance looks like.
Do you remember those choose your own adventure books where you read some of the story and then at a decision point, you get to choose what to do next? I'm going to start off with something similar. Go ahead and imagine yourself as my new patient towards the end of our first meeting. You've been telling me about having trouble sleeping for what seems like months, and you never seem to have the energy to get out of bed. You feel numb, down, and sometimes cry for no reason. You're still managing to go to work most days, but can't concentrate. And once you're back home, you just want to crawl into bed, skipping dinner because you just don't feel like eating. Even your family has noticed that you seem distant, which leaves you feeling overwhelmed with guilt. As your psychiatrist, what do you think I should do next? You have 4 choices. Choice A, let's label it. Just diagnose the problem already. Maybe you think it's as easy as taking a test or filling out a form, or I could always just analyze you. So if you're sad, that's depression, and not concentrating means ADHD. Can't sleep, obviously insomnia. Congratulations, you now have 3 diagnoses to feel better about. My job here is practically done. Choice B, throw meds at the problem. A lot of psychiatrists seem to like glorified pill pushers, and so it's easy to think medications are always the answer. I might start an antidepressant for your mood, a stimulant for your energy and concentration, and some sleep medication for your insomnia. You get whatever's popular or the clinic has samples of. Problem solved, right? Now, instead of walking away with 3 diagnoses, you get 3 medications instead. All right, how about option C? Just take whatever the doctor gives you. You don't want to start off with 3 meds, or you're shocked by getting 3 new diagnoses. Don't worry, the doctor is always right, and you shouldn't complain. I mean, after years of medical school and residency and board certification exams, all of my experience, how can you argue with that? Clearly, I'm the one with all the answers. I check boxes and write prescriptions, and within 15 minutes, we're done and you can move along. And here we are with choice D, building the therapeutic alliance. Okay, so what exactly does that mean and how does it help? The therapeutic alliance is really just a fancy way to describe our professional relationship where we work together to reach your treatment goals. Having a strong, positive therapeutic alliance with me means better treatment results for you. We start building it beginning with our first encounter, whether it's on the phone or in the ER or over a computer screen. And through all of our interactions, you're deciding if you trust me to keep you safe, to help you make choices, and to genuinely care. When you're talking, my job is to listen. And when you ask questions, I offer my best, truest answers, even if it's I don't know. We work together to decide what's going on and what to do about it. Our relationship can make a real measurable impact on your mental health, from improving medication results to minimizing side effects, and even speeding up how long it takes to start feeling better. This means that if we have a really strong doctor-patient partnership, you'll actually do better no matter what treatment you choose. Sounds like choice D is a winner. But let's look at the real story behind the myths of options A, B, and C and get a little deeper into how this therapeutic alliance can work for you. All right, let's talk about labels, which was choice A. When we meet for appointments, especially in the beginning, I'm going to ask you a lot of questions. Psychiatrists spend 4 years in residency developing a lot of specialized skills for listening, observing, and communicating in ways that ensure you and I understand each other. But no matter how well we communicate, being diagnosed with a mental health disorder can be scary. There's this manual that psychiatrists use that's filled with different criteria needed to meet specific diagnoses. Most people don't love being labeled as soon as they meet someone, but this is an important part of what psychiatrists do because it helps us communicate what's going on to other medical and mental health professionals. It's also what your insurance company needs so that they'll help pay the bill. I wish it was more objective and not so gray and imprecise. There are a bunch of smart researchers out there trying to figure out how to make diagnosing easier and more focused. For most mental illnesses, it looks like there are hundreds of different genes involved, which makes pinpointing a single gene for a certain mental health diagnosis unlikely. And this is why questions about your family mental health history, if you have access to it, can be really important. Brain imaging also gives us tons of great data to work with. But so far, we can't just put your head in the machine, take a picture, and tell you what's wrong. But even if we could diagnose problems that way, these specialized techniques would never completely replace a relationship. Sometimes I may ask you what you think is going on, what you're worried the problem is. This isn't because I don't have a clue. It's a chance for me to understand what you may be afraid of and what seeing a psychiatrist means to you. Maybe you have ideas about treatment because your mom has the same issues. And since you share half of her genes, you want to try what works for her. This is a great place to start. Okay, back to our choices. Sometimes psychiatrists do throw meds at problems, but thoughtfully and not like in choice B. Psychiatry is medical first and foremost. We have medical training, ask medical questions, and prescribe medicines. Which brings me to one of the most amazing things about the brain. With a strong therapeutic alliance and trust that your psychiatrist is helping you make the best medication decisions, even something that is not actually an active medication can lead to real positive results. The placebo effect is when you get the real improvements and changes, but the medicine is fake. It's not an active medication, or it's too soon for it to actually work. Don't worry. No one is prescribing placebos to you. They are used in research when comparing effects with possible new treatments. But it's important because some mysterious non-pharmacologic mechanisms are at work here, releasing endorphins and dopamine and other chemicals and helping you to feel better without any of the active medicine. And this effect may play a big part in feeling better when you're taking prescribed medications too. Your brain is helping in ways that we don't fully understand yet, but no matter what specifically is helping you feel better, the effect is definitely real. That said, no one has to take medications just because they see a psychiatrist, and my patients certainly don't have to make that decision by the end of our first meeting. You're the one putting chemicals into your body, so the final decision is always up to you. But it can still feel like you're a guinea pig when we try something that's new for you. Even though psychiatrists understand how medications work and what side effects are most common, we don't know exactly how your particular brain will respond. And back to our options. Okay, unlike in choice C, doctor knows best, your psychiatrist really doesn't have all of the answers. In fact, on my first day of medical school, the dean told us, half of what we will teach you is wrong. It's your job to figure out which half, which is something I'm still figuring out now, almost 20 years later. But what I do know is it's good to like your doctor. It's really important to click with your psychiatrist to feel that they really get you and are interested in helping in a way you want to be helped. And just in case you feel anxious about being the patient and having to talk about your feelings to a stranger, know that you are not alone in this. Many psychiatry training programs require that residents see a psychotherapist to learn more about themselves and the experience of being a patient. I spent 4 often uncomfortable years of weekly visits in that same seat you're in now. And even though I'm not an expert in you and your personal experiences, I do know how vulnerable it can feel to be a patient. No one wants to be just fill in the blank diagnosis. You don't want to feel judged when you're asking for help. It's my job to understand your story in context. This means that we also have to be on the same page. And we get there because you tell me what's going on the best way that you can and let me know when I'm off base. Your psychiatrist's job is to help you feel better. I do that by asking insightful questions, talking about your treatment goals, and shared decision making. And just like any other relationship, ours will be a work in progress. But I rely on you to share your goals and experiences with me so I can offer treatments that align with your values. Even if you want me to make the decisions because I'm the doctor, that's great too. Just know that being interested in why I'm making these decisions can have a big impact on your progress because you're actively invested in your care. Want to know more about our story from the beginning? With the limited context I shared, this made-up patient meets criteria for major depressive disorder. But that's not the endpoint, and it doesn't tell me the next steps. That conversation will be led by this patient's concerns and fears, as well as their hopes and goals for treatment. We'd spend a lot of time fostering our new therapeutic alliance. You potentially have a lot at stake here. If you've been quietly suffering or avoiding the doctor because you're afraid of what they will say or prescribe, maybe now is the time to change that. Imagine what you could do with the right psychiatrist on your side. When it comes to mental health, struggling is not your only option. This is your story. What will you choose next? Thank you.
Thank you, Jess. So important to put the relationship in perspective as a relationship and not just as smart person treats uninformed person. And I love how you level the playing field so that we feel we can have an active role in our mental health. Thank you so much.